Hey guys, I thought I'd do a quick injection tutorial for you for a subcutaneous injection. So to start off with, you obviously want to make sure you've got your testosterone. You want to make sure you've got alcohol swabs. You want to make sure you've got your injection needle. Now, a lot of patients do these with just a 27G 0.5 inch. Of course, this is a fixed needle syringe. People do say that sometimes they feel the needle blunts, but I've not had any issues myself. But I will quickly demonstrate the steps from here of what you can do for a subcutaneous injection, as simple as possible. So you would take your alcohol swab first. Get your vial of testosterone. Ensure that you alcohol swab the top, obviously just to sterilize the area. And then from there, you would just discard the alcohol swab because you should only use them once. Next step would be to get your needle and syringe. As soon as you've got that ready, what I like to do is pull back to where my dose is. So in this case, 0.2, should be able to see that. So leave the cap on when you do this so that you don't introduce anything into the syringe. So 0.2. Take the cap off and then slowly push in through the rubber stopper and then push the air like that. Now this will take some time because this is an oil and it's a very fine needle. So I just pull back to here and I just wait patiently. It's slowly coming in, as you can probably see. And there's plenty of room to keep pulling back. And then push back up, and then I do it again. Creates like a vacuum effect. Obviously, a bit of patience required, but this is the thing that people have most of the problem with at the start. We're almost at 0.2. Pull it down a bit more. I usually go just a bit over because that accounts for the dosage and any loss. So we're at 0.15 at the minute, as you can see, a bit fiddly. This is why some people choose to use separate needles and syringes so they can use a bigger gauge needle to get the oil come through quicker. For me, it's just easier to do this. Less hassle, in a way. There we go, so we're at 0.2. If I just go a little bit over, let a bit more come in. There we go, we're just over. So for now, I will recap this very carefully. And then I'll take my next alcohol swab. Typically, if you're gonna do it this way, you need two. You're gonna have to excuse my hairy belly. But so you've got your navel there, come across to about this sort of region. So for example, alcohol swab that area. Get ready to take the cap off as soon as it's dried. Pinch an area like this. Slowly push the needle in. As you can see, no pain at all. And then you want to slowly push the plunger. Till the 0.2 goes to 0. I like to leave it for a second and then pull out. There we go, done. Some people like to rub it with an alcohol swab afterwards, just to ensure that just get any blood. Sometimes blood will come out, it's perfectly fine. But that's it, really. Injection done, and I mean, that didn't take me very long. I was obviously filming a video at the same time. The next one I do will be an intramuscular injection, which is my preferred method. You can use the same 0.5s to do shallow intramuscular into the quad, because if you were to extend your leg, you'll feel the muscle is there immediately. But yeah, if anyone wants any specific tutorials, if I can get them done, I will. But hopefully this helps someone out there, especially the beginners. Cheers.